Hello, I hope you're well. Welcome to our session on upper respiratory tract infection, where we're going to focus on tonsillitis and adenoiditis. My name is Winnie Berawa. If you're new here, this is a channel or a YouTube channel that focuses on lessons, interviews, and expert interviews pertaining to healthcare. If you're a returning subscriber, I really like to remind you to subscribe so that you can give us further support. We've done several sessions and looked at other respiratory tract infection, including the lower ones like pneumonia, asthma, pneumothorax, and so on. But in this, we're going to focus more on the upper respiratory tract with key focus on tonsillitis and adenoiditis. So in the previous lessons, we expressed that the upper respiratory tract has two levels. So we have the upper respiratory tract and the lower respiratory tract. So the upper respiratory tract has the nasal cavity, the pharynx, and the larynx, and this is our key area of focus. But the lower respiratory tract begins at the tracheal level, going all the way downwards to the bronchus, to the lungs, including the lobes, and even the pleural coverings. So in this class, we focus on tonsillitis and adenoiditis, and we will begin one by one, starting with the tonsillitis and then followed by adenoiditis. So tonsillitis, what is it? So tonsils are actually part of our immune system, and they belong to the system of lymphoid nodes, and they assist in producing protective antibodies, which protect us against pathogens and infections. But then sometimes the tonsils as an organ can actually get infected, or they can end up getting inflamed, leading to a condition we are calling tonsillitis. So tonsillitis is known to be more common among children or affect mostly children, but it can also occur in adults. And because tonsils are part of our immune system, however, we need to understand that they can get inflamed due to different microorganisms, and therefore they get to be inflamed and start swelling. In this regard, therefore, tonsillitis can be defined as inflammation of the tonsils. So to understand the location of the tonsils, it's good first to review the systems and the anatomy. So examining the tonsils, it's really good to do that using the oral cavity. So of course, in our buccal cavity or in the mouth, we're able to see the tongue, and at the end of the tongue, there are other organs that are located there, including the tonsils itself. So the central part of our posterior part of the tongue, we get to meet the uvula, but then on the lateral locations of the buccal cavity, we get to see the tonsils here. So normally when the tonsils are inflamed, they get to swell, they get to look very reddish, but in some moment you can discover some whitish spot, and on the tongue you can also discover the grayish due to the microorganism growing there and leading to more of the inflammatory status. So mostly when we are reviewing the inflamed tonsils, it's advisable you get to have a pen torch or a light that you can explore more to see how the status looks like. But majorly when you are checking on the tonsils, we will just review this using physical assessment. So on the causes, the tonsillitis is known to be caused by either viruses or bacteria, and the group A streptococcus bacteria are known to be like the common one. So how can we spread tonsils? It's a very infectious disease. You can easily spread it to other, but normally through inhalation, either through coughing or sneezing, but it's airborne basically. And then you can also get spread with tonsillitis through touching of contaminated surfaces or surfaces that has been exposed to microorganisms that are known to cause tonsillitis. Moving forward, what are the common symptoms or clinical manifestations that come along when a person has tonsillitis? We can expect presence of red swollen tonsils, just like we have explained before in the pathophysiology bit, that when the tonsils are inflamed, they tend to look reddish, they tend to swell. So When we do the physical assessment, then we expect to see red swollen tonsils or tonsils that have changed their normal appearance from just basically looking pink to appearing reddish. Then the sudden sore throat, that is tenderness around the throat areas. And then we got also painful sores or blisters on your throat, but also the state of difficult in swallowing. And this is common because of the pain that is around the throat and the irritation that comes around when the person is trying to swallow. Stiffness is also possible, reason being the tonsils are located around the neck and or the throat area, and when the person swallows, that place gets irritated, it gets to feel painful, and it can spread that pain across the other regions because of the tenderness of the tissues there. But then the stiffness comes around because of the straining of the tissues there due to the swelling, redness, and the tenderness. We got to experience headache. Part of the patient may show signs of headache, mainly because of the disturbance around neurological physiology around the area and the nervous disturbance. Remember, the throat is leading to the neck and even to the head. So we have also lack of appetite or refusal to feed. So for children, you may discover that majority of them, if you tell them to eat, they may strain to do that because it's painful, and anytime they try to swallow, they feel really they're straining. Then there's fever and increase in temperatures, could be generally, and you can observe this by just taking temperature. There's also swollen lymph nodes in the neck or around the jaw area. So looking at the location of the tonsils, it's expected because these are lymphatic nodes, and the inflammation tends to immediately bring an effect of swelling due to the tenderness, due to the fluid production or excess edema that originates there. In some cases, can have stomachache or disturbed stomach physiology. Bad breath can also present, and pain in the ears. So why are the ears coming in is because the tonsils are in a way connected through the ear spaces, and pain can also spread out. And sometimes if you don't manage this well, it can cause development of complication of illnesses like otitis media or peritonsillar abscess, which we had discussed prior, where it comes to complications of upper respiratory tract infections. So on the management of tonsillitis, number one, it's really good to offer adequate fluids to just keep the throat moist and to prevent any form of dehydration. But also warm fluids are known for, easing discomfort. The aspect that the place is really tender, it's painful, it has the neck stiffness. So warm fluids help to open up the arteries and the blood flow around that area, and it can promote healing, but also it eases the pain and even the discomfort brought about by the pathophysiology of the tonsillitis. Sucking on frozen treats such as ice pops or ice cubes are also known to reducing pain, especially on the first day where inflammation is really, really high. So when you give the ice pop, they help in reducing the vasodilation, or rather they promote vasoconstriction, especially on the first day. So it assists on making sure that the dilated vessels in this case are actually constricting, and you also want to ensure that the pain there is reduced, because one effect of inflammation is it causes in a way vasodilation. It also in a way makes the area very tender. So when we do ice, the coldness is known for bringing vasoconstriction, or it helps in reducing the diameters of the vessels due to the inflammation process. But also ice is known for calming effect around the place. So we use ice pops or ice cubes early in the disease manifestation, but as the progress keeps on, let's say 48 hours later, it's good we do warm fluids, is because we want to open up the vessels more and allow blood to flow to the area of infection so we can heal it faster. We can also do pain management through use of ibuprofen and acetaminophen to just ensure that we lower the inflammatory processes, but also to eliminate the pain. And then we can do humidification to reduce dryness of air and to promote proper breathing in case the patient has ineffective breathing issues, and then gargling of salt water. So salt water, we've discussed that it inhibits the growth of microorganisms because it provides a very harsh environment where most of these bacteria and viruses are not able to culture and grow. And rest is important mostly because it helps to conserve energy and to also promote healing and adapting to the symptoms of tonsillitis, because in tonsillitis the client can complain of malaise, that is general body weakness. Remember, they're also not eating well, so the low appetite part for these children or the patient in this case can really limit the amount of energy they are able to produce. So rest is necessary to just conserve the energy, but also at the end of the day, you want to give rest so that the client can adapt to the symptoms and promote healing. Surgery is recommended in case there is observation of recurrent episodes of tonsillitis or it indicates complications of tonsillitis. For example, hearing loss, or the patient is showing signs of hearing loss due to the tonsillitis episodes, or you find other cases where the disease is spreading to other areas and this gets to complicate. So we can go for surgery, and the surgery that we're going to do here is known as tonsillectomy, which is the removal of the tonsils. So tonsillectomy is a surgery or a surgical procedure advised to be done if you find that the tonsillitis is repetitive or keeps on coming back, and so you want to just eliminate the tonsils so that they don't get to be infected over and over again. Then takes us to disease number 6, which is adenoiditis. So this comes from the word adenoids, and adenoids are also part of our lymphatic nodes. And adenoiditis, in definition, is inflammation of the adenoids. So because adenoids are lymphatic tissues, they're also located at the posterior part of our nasopharynx, and they also help produce antibodies which help us to keep us more safe and immune or protected from microorganisms. So when we try to locate adenoids, they are neighbors to the tonsils at the end of our mouth or at the posterior part of our nasopharynx. And so if you look at the relationship, adenoids are superior to the tonsils. So you find them here. They're literally bordering the uvula. So if you are to organize these three tissues, then it means you're going to have uvula, followed by adenoid, then followed by tonsils. So adenoid and tonsils, these are lymphatic tissues or lymphatic organs that help produce antibodies, and these antibodies are critical to protect us from any form of infections. However, we need to appreciate that the adenoids can also get infected, and in that case, inflammation of the adenoids is what we call it adenoiditis. All right. So, because adenoids and tonsils are like near each other, therefore, we are told infections of the adenoids frequently tends to accompany tonsillitis. So in presence of tonsillitis, you can also check on the adenoids to confirm if they're affected or not, because they tend to happen at the same time. So causes of the adenoiditis, you can have group A beta streptococcus, bacteria, viral or viruses, allergies, and even acid refluxes. So these are like the common symptoms, but if you want to go into the specifics, so the common bacteria that are detectable during adenoiditis, we'll find that we have Haemophilus influenza, we can get Streptococcus pneumoniae, we can get Streptococcus pyogenes, and there could also be Staphylococcus aureus. So these are common bacteria that you can find in cases of clients who complains of inflammation of the adenoids. But then, to just remind us, we have highlighted like examples or major examples of these microorganisms. And so if you want to reference to the whole list of the different microorganisms, you can go to our first session where we did rhinitis and pharyngitis in terms of upper respiratory tract infection, and you'll see all the list in reference to the regions where the infections are happening. So clinical manifestation for a client who has adenoiditis, you find number one, there is mouth breathing. that is, they're not able to sustain breathing through the nose, so they start engaging the mouth. And then we have earache or pain in the ears. There's draining of ears because of fluid drainage that is going to the ears and complicating in form of otitis media. But then there could be presence of foul smelling breath. Voice also tends to get impaired because remember the adenoids are just neighbors to the larynx also, so you can have voice production getting affected there. Or the client starts having noisy respirations or snores or snoring basically, and then there could be fever, increase in temperature or pyrexia, and then nasal congestion is also observable. So when you look at adenoiditis, because it's literally on the border location between the nasal cavity, the pharynx, and the larynx, the symptoms tends to cut across, but you need to appreciate the presence of difficulty in breathing, the noisy respirations, the nasal congestion, and increase in temperature. But now look at the ears getting involved here. So this is a client who will complain of pain in the ears or drainage of fluids from the ears, could be pus or other infection related fluids, including mucus. So when we wish to diagnose our client of adenoiditis, we can do physical examination to just confirm in the mouth or oral cavity, locating the adenoids and checking how they look like. They look swollen, do they look inflamed, are they tender, and so on. Then you can do a throat culture by doing a swab, and then you can use this swab to do culture sensitivity to exactly determine the microorganisms that are present on the site. But then we have allergies. So when it comes to allergies, here we are looking at any form that could bring allergic adenoiditis. So we can do allergy test to just confirm if truly there is any presence of such. Then endoscopy is also good. So with endoscopy, here we are directly viewing the adenoids to just confirm if they are clear, if they appear normal, or again, you can detect any form of inflammations. So in form of complication, here our nearest organs are the ears, and so part of the most common complication is acute otitis media. So through the eustachian tube, if the disease is not well managed and microorganism eliminated by either giving medications or needed interventions, then the eardrums can get affected and we end up developing otitis media. We can also get cases of acute mastoiditis again. So this is infections in the mastoids, and then you can have hearing loss. So normally when otitis media is not managed on time, it tends to affect the level of hearing for people. So because it affects the membranes or the eardrums, so you find that the otitis media chances for it to complicate in form of hearing loss is really high. So let's look at the management of adenoiditis. So because this is inflammation of the adenoids, I will look at mainly the adenoid part, even though we had said that tonsillitis and adenoiditis tends to happen at the same time because they are neighbors or they literally they border each other. So first of the approach we can do is assess and monitor vitals. Here we are looking at airways, patency, neurological status. So the assessment is critical. So you assess vitals, you assess airway patency, and assess for any neurological status. Here you want to confirm number one, the vitals are stable, and part of the vital we are looking at here is respirations, and also going to look for temperatures. But then airway patency, you want to confirm that our client doesn't have any form of difficulty in breathing. But then neurologically, you want to rule out headache, you want to rule out any nervous issues. And then you can initiate pain management. So remember, this is a client who is complaining of sore throat, is complaining of neck stiffness and pain basically around the throat area. So you can do again ibuprofen, we can do acetaminophen. But then we got fluid and electrolyte balance. So here we can encourage a lot of fluid intakes. And for the fluid intakes is critically because we want to prevent any form of hydration, but also if we question any status of fluid loss, or this is a client who is producing a lot of mucus, the fluid can help us loosen up the mucus and allow it to come out. And then we have psychological support, that is to allay any form of anxiety, to confirm that the client is going to be stable and to respond to even the management that you're offering. So this is going to give us cooperation and support. Then you can do antibiotics, broad spectrum. So you can implement amoxicillins, you can do penicillins. So these are known for acting on the microorganisms that are growing around the throat area that are leading to development of this adenoiditis or inflammation. Antihistamines are really good in the cases where this is an allergic reaction. So if there are presence of any irritants that are leading to stimulation of this inflammation and causing the adenoids to be inflamed or to swell and to look red, then you can give antihistamines. Then the other class of medication that we can work with are the proton pump inhibitors. These are more like antacids. So what these drugs do, they will help us work around causes like acid refluxes. So we need to appreciate that we have some people who suffer from acid reflux illnesses where they tend to have high acidity in their body, and part of this tends to affect the adenoids. So working with proton pump inhibitors are really good as they help in balancing the acidity in our system and reducing any impact on the adenoids. Surgery are suggested or advised in case also you discover that there's recurrence of inflammation on the adenoids, or the episodes of adenoiditis are very frequent and you're worried that if you don't do much then it will keep repeating itself. So the surgery we're going to do in this case, we call it adenodectomy, or in simple term we mean removal of the adenoids. So you can go for adenodectomy in cases where it's recurrent or it's causing complications of other parts of the respiratory system. So having mentioned that we may need to do adenodectomy, which is removal of the adenoids, I would like us to understand what are the management we're supposed to do when we're handling a client who is prepared for adenodectomy. So we shall do the preoperative management and we shall do the postoperative management. So preoperative management means before the client goes for adenodectomy, what are we supposed to do? So first thing first, we need to explain the procedure to the patient. And in this case, you want the patient to understand what are we supposed to prepare in advance? How is the procedure going to look like? What things are they supposed to do? What things are not supposed to do? So you want to explain each and every part of that procedure so that this client can give us consent. And in this case, we talk about informed consent. This is where the client accepts having understood the risks, having understood the status of the procedure, and they are ready for the outcomes. So obtain consent, preferably in signed format. Get the forms they sign and document them well. And then after that, we can now start on the pre-operative assessment. So we want to cross-examine our client to rule out any history, for example, of bleeding disorder. Because this is invasive, we're going to cut the adenoid tissues, we're going to remove the adenoids. You'll be worried about some bleeding for this client. So we need to confirm that this is a client who doesn't have any cases of bleeding diseases, more so diseases such as disseminated integrated coagulopathies, or you can be worried about leukemias and so on. But they can also look at other infections, like are you sure this client doesn't have other infections, so that you don't risk spreading those infections during the adenodectomy procedures. Then do we have any medication that the client is taking? For example, medication that affect blood clotting. For instance, if a client is due for surgery, we need to stop any medication, for instance, ibuprofen, which are known to thin our blood, what we call them blood thinners. Other drugs that we know or in this regards are drugs like aspirin, which are also known for blood thinning. So these are medications that we need to ensure the client is not taking, or we wean them off before the client goes for these surgeries. Rule out any allergies to specific medications that you may be aware about from the client, and avoiding some of this reaction is going to make the procedure at least bearable. Then having confirmed any of these risks, then we go ahead and maintain our patient on what we call NPO. NPO means nil per oral for at least 3 hours. Sorry, not 3 but 6 hours. Why are we doing this? Is we don't want our client to regurgitate during the procedure, because either the stomach is full or there's presence of food, and in some due cases this food can regurgitate or reflux, leading to some complications like choking. Then remove any jewelry and any makeup before the surgery, but also offer psychological support to allay anxiety in preparation for this procedure. And so, having successfully complicated the procedure, then our client will be managed on postoperative management of adenoidectomy. So first thing first, when the client is out of surgery, it's good we monitor for complications, and priority here is bleeding. Remember we said when a client is leaving surgery, we need to first having confirmed they don't have any bleeding disorders. But once they're out, then you need to check that this client doesn't have complication in form of hemorrhage or bleeding. So you can check this, for instance, by looking at the swallowing. They seem to have increased episodes of swallowing, and they are not on any meals. Do you have any vomiting of blood? But also check for change of fever or temperatures, like presence of fever or excess pain. This could also show could be an infection, but also rule out any form of airway obstruction. Then looking at pain, because surgery is an invasive procedure, this client can complain of pain around the neck area. So administer any pain medication to just reduce the pain feeling or the pain stimulation. We can also advise on ice cubes to just cool down and promote more comfort. When it comes to oral intakes, once the gag reflex is back, we can go ahead and encourage cool liquids, like water, broth, diluted juices, but avoid any acidic or irritating fluids. It's because acids are known for worsening inflammatory effects. So you can reduce any acid intakes, but also avoid irritating fluids that can worsen any state of discomfort there. Then rest and activity is encouraged. However, you are told encourage enough rest and limit any strenuous activities. This is to conserve energy and to promote healing. When it comes to infection prevention, remember adenoiditis simply is inflammation of the adenoids, who are like located at the back of our nasal cavity, but also they are located at the back of our mouth. So hygiene practices are very critical. Otherwise, you can reintroduce infections there. So proper hand washing and hygiene is quite important to just prevent infection. Then educate on follow-up and reinforce on treatment follow-up, treatment adherence, checkups, so that this case can be checked on. If there's any complication, they can be identified in time and something can be done about it. So thank you for staying through and through all the way to the end. Give us a like if this video is very impactful to your end. Leave us a comment to give us a review on the part that you understood more, and then share with your colleagues. And don't forget to subscribe. So thank you so much, and see you in our next lessons. Bye.